Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, hydronephrosis. So, in the hydronephrosis, we have unilateral hydronephrosis and bilateral hydronephrosis. First, unilateral hydronephrosis. In unilateral hydronephrosis, the obstruction is present only in one side of the kidney, whereas the other side of the kidney is completely normal. This unilateral hydronephrosis is again divided into three types. One, we have extramural obstruction. One, we have extramural obstruction can be seen. Okay. Second, we have intramural obstruction is seen in the patient. Third, we can see intraluminal obstruction. Okay. So these are the three types of unilateral hydronephrosis. First, extramural obstruction. If there is a tumor in the adjacent structures, like if there is a tumor in the colon, or if there is a tumor in the cervix, prostate, rectum and colon, it will definitely block the ureter, resulting in extramural obstruction. Extra is outside, mural is muscle, outside the ureteric muscle obstruction. So here the tumor can cause extramural obstruction. Second, idiopathic retroperitoneal fibrosis. Ureter is partly retroperitoneal structure. So if there is fibrosis of the retroperitoneum, obviously this will cause traction over the ureter, resulting in obstruction leading to unilateral hydronephrosis. Second, if there is retrocaval ureter. What is retrocaval ureter? This is the inferior vena cava, and if the ureter is present behind the inferior vena cava, then this inferior vena cava will compress the ureter, thus resulting in obstruction. So this is also responsible for extramural obstruction. Second, intramural obstruction. In intramural obstruction, here inside the muscle, so this is also unilateral. So intramural obstruction can be congenital stenosis. This is the pelvis, renal pelvis. This is the ureter. There can be congenital pelviureteric obstruction due to stenosis. This congenital stenosis resulting in pelviureteric obstruction is one of the cause of intramural obstruction. There can be ureterocele. This ureterocele is the dilatation of the ureter in the bladder. It gets dilated and it gets inserted into the wall of the bladder itself. So this is called as ureterocele. So this can also cause intramural obstruction, and because of this ureterocele, the ureteric orifice becomes small, resulting in obstruction. Then there can be some inflammatory strictures can be present, resulting in obstruction. And if there is the neoplasm of the ureter, if there is cancer or tumor of the ureter, then this can, in the ureteric wall or in the bladder wall, if there is a cancer, this can cause obstruction, resulting in the unilateral hydronephrosis. So these are the causes of intramural obstruction. Then we have intraluminal obstruction. In intraluminal obstruction, the obstruction is present in the lumen here. So that means here the obstruction is present in the lumen. Like for example, first thing is calculus. If there is a stone which is present in the lumen of the ureter, and if it gets obstructed, then it is intraluminal obstruction. Either the stone can be in pelvis or ureter, obstructing the ureter. Second, sloughed papillae in papillary necrosis. In papillary necrosis, there can be sloughed papillae which results in obstruction of the lumen of the pelvis. So this sloughed papillae or papillary necrosis is seen in conditions like diabetes mellitus. It can be seen in analgesic drug abusers, and it can be seen in those conditions with sickle cell anemia. Also we can see this. So all this can obstruct the ureter. Then we have bilateral hydronephrosis. Where do you see bilateral hydronephrosis? Actually, both the kidneys will come together, and both the kidneys will drain the urine in the same urinary bladder with the help of ureters. Now from the urinary bladder through the urethra, it goes to the outside. So anything from this level, if there is any block in the urinary flow, then this result in hydronephrosis. So whenever there is block here, then the bladder will be filled, so the both the ureters will be filled, resulting in hydronephrosis of the both the kidneys. So this bilateral hydronephrosis is divided into two types. We have congenital bilateral hydronephrosis or acquired bilateral hydronephrosis. In congenital bilateral hydronephrosis, one presence of posterior urethral valves. This posterior urethral valves will result in narrow ureteric orifice. Because of this narrow ureteric orifice, there is hydronephrosis, bilateral hydronephrosis is seen. There can be congenitally ureter is not properly formed. That is congenital urethral. Congenital urethra is not properly formed in the at birth itself. So this congenital urethral atresia will present with bilateral hydronephrosis. Second, acquired conditions. Acquired conditions can be, there can be benign prostatic hyperplasia or carcinoma prostate. This benign prostatic hyperplasia and carcinoma prostate will cause enlargement of the prostate gland. When the prostate gland is enlarged, so this will compress the urethra, resulting in bilateral hydronephrosis. Then bladder neck scarring. Here this is bladder neck. Sometimes after the operation, post-operatively, there may be scarring of the bladder neck can occur, resulting in bilateral hydronephrosis. Urethral stricture, the same cause, and phimosis are the causes of bilateral hydronephrosis.
Thank you and thank you for watching.